We welcome in, for the second time in a couple of weeks, 4th District U.S. Representative Jim Himes. Congressman Joe and Ray, good morning. How are you?
Good morning.
Good morning, guys.
Obviously, Fairfield County, your district, has been the state hotspot as far as the pandemic is concerned. What's the latest update you can give us from down there? And how is the mood, Congressman, of people in your district?
Yeah, well, you're absolutely right. We've got probably, about a fifth of the population down here in my congressional district, which is basically Fairfield County, and we've got probably 2/3 of the cases and just under 2/3 of the fatalities from the coronavirus. So there's a lot of fear down here. But just as is true everywhere else, our hospitals are heroic doctors and nurses, who looks like they're going to get some relief with the construction of, National Guard and others helping to build some additional beds and whatnot. And so, there's a lot of fear, but just like everywhere else, we've got story after story of people doing absolutely heroic things. And of course, we're hoping that in the next week or so, some of the shortages that the hospitals are experiencing in personal protective equipment and other stuff may begin to ease up a little bit, but it's pretty rough down here.
Representative Himes, I just promoted you. Representative Himes, what are you hearing from your hospitals? Are they getting swamped, or what's going on down there?
My sense is from talking to them that they're okay for the moment, but the curve is still pretty steep of new.
Uh-oh.
Kind of 2 to 3 days away from being out of protective equipment. The beds are starting to fill up, which is why you're seeing, and this isn't just true in Fairfield County, all over the state, you're seeing the Army Corps of Engineers and the National Guard building additional capacity. So there's anxiety, but we're not quite yet at capacity on the hospitals here.
Okay. I know I read this morning, Congressman, that they're looking at Webster Bank Arena. They haven't done anything with it yet, as a potential spot like the Javits Center is in New York to house either COVID patients or patients hospital patients who don't have the pandemic, or perhaps even doctors and nurses. What kind of a big undertaking would that be?
Well, it's pretty big, I'll tell you. I mean, it's not, it's a job, but it's not a massive job to put, as you've probably seen the pictures of Javits Center and elsewhere, to actually set up the beds and that kind of stuff. But actually managing that, I mean, if you think about it, the city of Bridgeport has 2 hospitals, St. Vincent's and Bridgeport Hospital, and how you manage that, because now doctors and professionals need to be over there, and, they need to divide up their people. So, it's a big deal. And of course, throughout, you don't want the quality of the care to drop. I mean, just because there's dozens and dozens of coronavirus patients coming in the door, that doesn't mean that you're not seeing your usual, chest pains and strokes and that kind of thing. So it's a huge management undertaking. And of course, our hospitals don't ever want to let the quality of their service for people drop.
And I know this is hypothetical at this moment because Joe kind of brought this up, though, and that is, if you used Webster Bank Arena, what would go there? Would that be critically ill people, or would that be just, as you mentioned, the run-of-the-mill patient?
Yeah, my sense is, and I'm always hesitant to answer questions that are medically related, but, for example, we all saw those incredible pictures of the USS Comfort coming into New York Harbor yesterday. That ship, which is obviously just a floating hospital, a lot of beds and healthcare professionals, that's going to be used for non-COVID cases, right? These external facilities, they're not intensive care units, which at the end of the day, if somebody really goes critical with coronavirus, that's what they need. So the honest answer to your question is I'm not sure how they're going to divide up that space,
it's up to them.
But traditionally that's been used for your less severe non-COVID cases.
Talking to 4th District Congressman Jim Himes down in Fairfield County. Congressman, what's the sense of your constituents concerning people coming in from New York? I mean, we see the governor of Rhode Island basically putting up a virtual roadblock, checking cars with New York plates coming in to her state and making them self-quarantine for 14 days. Do people have that same feeling in your area, or because you're so close to New York, they feel differently about it?
Well, no, I would tell you there's a mix of opinions down here. And yeah, we're partly the epicenter because we are close to New York. There's plenty of folks that have apartments in New York that also have homes down here in Fairfield County. So one of the reasons, of course, that we have the caseload that we do is because we probably get more traffic coming in from New York than the rest of the state. But, I also think people understand. I mean, there's a reason why the president didn't put the tri-state no travel ban in place, because his medical professionals told him that would be far more disruptive than it would be helpful. And I think at the end of the day, people understand down here that, we already have a lot of cases. And it's not like if you're stopping people from coming across the border that are just on their way to Rhode Island or that are on their way to their weekend house or whatever it might be. That's actually not going to do much relative to the number of cases that we already have. And of course, talk about a potential economic nightmare. There's all kinds of people who commute back and forth to New York down here. An awful lot of our cargo traffic comes through here, including to the rest of the state. So, I mean, there's a reason why the president, when he listened to the experts, decided not to do it, because it would end up causing a lot more harm than good.
And the other thing that as you know, a number of the areas down there in Fairfield County, a lot of the towns, South Norwalk comes to mind, a lot of restaurants. I mean, there are a lot of people who've lost their jobs.
Yeah, that's exactly right. Everywhere. Lots of people out of work, and our neighbors are all ordering Uber Eats and ordering food. But I've talked to restaurant owners, and that replaces something like somewhere between 10 and 20% of their income. So yeah, and people forget. Look, Fairfield County, where I guess we're known as the Gold Coast, but we got an awful lot of people who struggle down here, particularly in our cities. You mentioned Norwalk and Bridgeport and Stamford. And those tend to be people who are working in restaurants or working in places where they have now lost their jobs. So yeah, no, we're feeling it, no question about it.
And finally, you were part of the bipartisan House delegation that approved the resolution, and I was fascinated to read this morning that it was a bill originally put in by your colleague, Mr. Courtney, that a year and a half ago that turned into the House resolution that passed the economic, they don't want to call it stimulus, but the economic aid package.
Yeah, I think that's right. I think it was originally Joe Courtney's health insurance bill. So yeah, Joe, what I say, he scanned to where the puck was, no doubt about it.
Well,
I don't think he ever imagined it would be a $2 trillion biggest bill ever passed in the history of the country, but
no, I don't think that was the intention. Well, Congressman, thank you for jumping on with us. Stay safe. Good luck to everybody down there, and we appreciate your time.
Thank you very much.
Stay